Welcome to the Revita Health and Wellness Show. I'm your host, Francine Marie, and we're with Dr. Peter Fotinos with Revita Medical. How are you?
I'm doing well. How are you doing, Francine?
I'm doing great. Now, we can get online anytime, revitamedical.com, and we want to know right now, what can we expect from Revita Medical? We know that you help us with our hormone replacements, so
if you're looking, most people will come in for various reasons. Most of them they would consider age-related issues, hair, skin, and nail issues, weight issues, memory issues, sleep issues, energy issues, inability to build muscle, lose fat. So they would come in for different issues, and what we would do is our health wellness coordinator would talk to them about what their issues are. I kind of screen them to see if they're good candidates for our program. We don't want to just take anybody. We want people that are ready to change the way they are. And most people that just come in to see me that say whatever you say, doc, are the kind of patients I really don't want to see, because I want people that are invested in their history, in their health. Mm-hmm. Francine, you're a patient of mine. We can go through and kind of tell you how your experience was, or you can tell them how your experience was, and kind of what we were looking for and to do for you. Mm-hmm. I know you had come in and was having some issues, one of them being hair and weight and energy and sleep, and there were some other things too.
Turning 50.
Yeah, some menopausal issues too.
And libido was really down.
Yeah.
And I thought it was normal.
Yeah.
I thought it was normal because other doctors had told me, this is normal for your age, Francine. But I attribute everything that has happened in the time that I've known you.
Yeah.
Just success. Feeling good, looking good. Yeah, looking good.
Yeah.
But that's what women want, don't we?
Yeah.
We want to look good.
Well, nobody wants
50.
to start forming wrinkles and start hunching over and losing hair color and feeling like crap. That nobody wants to do that. And when you came in, you sat down, you kind of gave us your whole history, kind of what's going on with you. We got your vital signs. We made you do the symptom sheet, which is a very key point. If we don't have that symptom sheet, it kind of hamstrings us, because there may be something that you're not remembering that we need to approach and touch on, because it may be very valid for what we need to do, and maybe a very important thing that we need to deal with.
I love that questionnaire.
Mm-hmm.
It made me really think about things.
Yeah.
Because as a patient, we don't think, it's like, oh, well, I just feel that way. But you feel that way because of this.
Yes. And most people, they don't consider things that they could. The problem with a lot of people that come in, and you'll probably echo this, is that they think, oh, that knee ache is normal. I just get up because I'm getting older, but that may be a telltale sign that you are having hormonal issues, because a lot of the hormones are there for repair of muscles and bones, and if you start losing them, you may have that knee ache. But you're not thinking in your mind, because you might have more important issues in your head, like, hey, the libido, the energy. Those might be more of the core problems, and we focus on those. If we can't get those fixed, then everything else doesn't really matter. For the most part, we try to get you as close as we can to where you feel the best in those issues. So if your issue is low libido, energy, skin issues, let's say as an example, then we try to get you to those. Those are the things we focus on. But then these other things are important as well, because they also can tell me how we're doing as far as fixing your hormones and getting them where they need to be.
So I have a teenage daughter,
Mm-hmm.
21 now, but many years she goes, Mom, you've got an attitude. So my mood swings would go up and down. I'd cry, I wouldn't cry, I'd be mad, and now she goes, oh my God, you're so nice.
Yeah. That's another one. Mood swings is a big one that we see, and that is very hormonal. I mean, if anybody, that's the term they use people for when they have mood swings. They're hormonal, and it's not necessarily too much hormone. Typically, it can be if your estrogen goes too high, because that will happen during menopausal years. It's more of your hormones dropping and going up and down. They're not being regulated. So we had you come in. We looked at everything. We spent some time talking to each other. I know that for a fact. And
I love the hour consultation.
Yeah.
Loved it.
Yeah.
And you get spoiled.
Yeah. Most people don't get kind of. I've had people come in and like, I think I've told you everything I need to tell. I was like,
But no, there's more.
Well,
Let's
there's more.
talk.
Yeah, let's talk. Because of the way most people are institutionalized in medicine, they think the doctor only has about 15 minutes for you, maybe even less than that. Nowadays, what's the studies now showing? 3 to 5 minutes doctors have with patients because they have 30 patients waiting in the waiting room. We don't book a lot of patients during the day. We want to give people enough time. You know, even our phone appointments, although they seem short, I'm giving you 15 minutes. Most time, doctors on a phone appointment is 1 minute or 2 minutes and says, "Hey, you're normal." Click. You know, so if we don't have any, and most of the time when we start noticing shorter periods of appointments means that we're hitting your goals. And I'm happy. I'm like, man, this is a short appointment. That means we're doing what we need to do. You know?
And that was my third appointment.
Yeah.
You know, the second appointment was pretty quick too.
Yeah.
Well, it was like almost 30 minutes
Yeah.
after you got the blood work back, and
Yeah.
then we talked about, you know, what I was deficient in,
Yeah.
what I needed to raise.
Yep.
And then the third appointment was quicker, and I'm like, I feel better. And the questionnaire that I filled out, again,
Numbers look better. Yep.
the numbers look great.
Yeah. And we check your blood work every 6 to 8 weeks, depending on what we need to look at. And it becomes less and less blood work. People get freaked out. Oh, there's a lot of blood work being done. Well, over time, it gets less and less blood work as we hit things where we need to be. You know, that first visit is when we do draw the blood. There is a quick physical we do, and one of the things I do tell patients, and you remember this, I give you a booklet on hormones, my card. Again, people can communicate with me nights, weekends, holidays, days, does not matter. If you have a question, email me.
And I email you, and you answer right back.
Yeah, and that's the funny thing about it. I had a patient recently come in similar. One of the things that one of our, because they came in as a referral. A lot of my patients come as referrals because people are like, "What are you doing?" And they tell me, "I go here," and then they come here to see me. And they, one of the big things. This lady says, what they told me, was that, when I email, that's the only way I typically communicate. And they say, you email right back, and you've been doing that recently with me, and, since the last few times, it's very happy because there's a feeling of being heard, if I don't get your email, it goes in the spam. I'm sorry, retry to send the email, but, for the most part, I'll respond to your emails. If I don't respond to it, I will get to somebody. If it's something that I need to be taken care of by one of my nurses or my medical assistant, it's not a question of where I need to answer a question. I'll forward it to one of my staff and say, take care of this, please. So it's one of the easier ways to make sure we get communication between the patient. I will get on the phone with you, too. I mean, that's not, as long as I ask for is appointment time.
Exactly.
Because I get busy. So, and even if you want to come in, the program is set up to where you don't have to pay extra per visit when you come in, especially since it's a monthly program. What we want people to do is use us. Okay, I don't want you to feel like you're inconvenienced because your money is going for these services. So if you need to come in and see me, and you're having an issue, don't wait 6 weeks to your next appointment. Come in and see me 2 or 3 days, or they'll get the appointment on. They'll get you on the phone. It'd be the easiest way. And we fix the problem right then and there, because most problems with hormones can be fixed in 2 or 3 days, not 6 weeks. So why should you sit there and suffer? We used to do a fee-for-service model where you come in and you pay every time you come in, but that's not inconvenient for people. They don't. Money's important. They want to make sure that
Right.
So that monthly fee is a better, I think, a better model, and it's actually turning out to be a better model because we can actually, again. Patients focus on the fact that, hey, I don't have to pay every time I come in. I can call and email and communicate. Because communication is very important in this medicine. In this medicine, if you look at a lot of the research on it, it's hormone replacement is more driven by symptoms than it is blood work. Blood work is important, gives you a point in time, but your symptoms transcend time. So if you're not feeling good, especially if you're one of the ones that they call subclinical hyperthyroidism, the numbers look great, but you're showing signs of symptoms of low thyroid. You got, in that situation, if you look at the studies, you got to treat them for thyroid disease. That number is lying to you. Okay, testosterone. I mean, you can see this on the Neurological Society. It says that you should be treating people based on signs and symptoms of low testosterone, because what level was good for one person may not be a level that's good for another person. We try to get you to optimal levels, but you might not live there. You might have been living at a much lower level, which we go too high, then hey, this is too much. If you go too low, then hey, we need to get you a little bit higher. But for the most part, your symptoms guide you, and that's why that symptom sheet, which you first filled out when you came in, is so important. That 30-minute appointment that you were talking about is when we really look at the patient, symptoms, and hormones, and the blood work. And we go through and say, hey, this is what I see, this is what I recommend. Now, the most important thing people need to know, you can do all of it, none of it, or some of it. I can't force anything down your throat or in your skin or on your skin. But I'll tell you why you need it, and then we're going to work together. I want patients to challenge me. I want them to say, hey, this is what I'm concerned about. Hey, this is the studies that I saw that show me that this is not something you need to be concerned about. Do you have any questions on that?
Right.
So that's one of the things that people need to understand. I want them to be engaged, because most people that come and see me are engaged in their because they're seeking us out, because they're like, hey, I don't like how I feel. I want them to be engaged, because if you're engaged, you're invested, and if you're invested, you're going to take your health by the horns, and you're going to get what you. Nobody out there is going to be more interested in your health than you are. So, I'm interested.
Yeah.
But more people.
Right. Need to be more
active. Yeah.
Active, invested, because you're about the proactive approach. And before I leave out today, we have got to talk about weight loss.
Yeah.
Oh my God, it's amazing.
Yeah.
Puffiness.
Yep.
You know, I got my 20-year-old face back.
Yeah. Yeah.
I never would have thought that.
Well, it's multifactorial. If it's bloating related, it's going to be estrogen hormone related. If it's going to be actual fat related, then we look at and see, hey, what is it? Testosterone not high enough? Is your thyroid not high enough? So it's and estrogen actually will help with reduction in fat as well. But we have to look at all the factors in that. We do have other programs that we can help with weight loss. I mean, paleo diet is a big diet that we push for. We also have the HCG diet that we work with. So it's multiple things that we do. So.
I love it. Dr. Peter Fotinos, I'm Francine Marie, and I am a patient, and I am so proud and honored to know you, so that I can get to know myself for many, many more years. I'm going to live forever.
I'm going to try to help you.
RevitaMedical.com or call 704-847-0011. Thanks, Doc.
Thank you, Francine.